How baking soda can help you with diabetes. Welcome back to our channel, where we bring you the latest health insights. Today, we're exploring an intriguing topic, the potential benefits of baking soda for diabetes. Baking soda, also known as sodium bicarbonate, is a household staple with numerous uses, from baking to cleaning. But did you know it might also have implications for managing diabetes? As research evolves, there's growing interest in how this common kitchen item could support blood sugar control and overall health. Before we dive in, don't forget to subscribe to our channel for more informative videos and ring the notification bell to stay updated. The science behind baking soda and diabetes. Recent studies have sparked curiosity about the role of baking soda in managing diabetes. Preliminary research, including animal studies, suggests that baking soda may influence inflammation and insulin sensitivity, two key factors in diabetes management. It's thought that baking soda could help reduce acidity in the body, potentially improving the function of insulin receptors and aiding in glucose metabolism. However, it's important to note that these findings are still in the early stages, and more research is needed to confirm the efficacy and safety of baking soda as a supplementary treatment for diabetes. Mucormycosis and diabetes. People with diabetes, particularly those with uncontrolled blood sugar levels, are at a higher risk of developing infections, including mucormycosis. This rare fungal infection can cause serious health complications, especially in immunocompromised individuals. High blood sugar levels can compromise the immune system, making it easier for infections to take hold and more challenging to treat. Managing blood sugar levels effectively is crucial in reducing the risk of such infections. Baking soda and mucormycosis. In addition to its potential benefits for diabetes, baking soda has been explored for its antifungal properties, particularly in the treatment of mucormycosis. Sodium bicarbonate may help inhibit fungal growth by creating an unfavorable environment for the pathogens, potentially slowing the spread of the infection. While promising, this approach is not a standalone treatment and should be considered alongside other medical interventions, such as antifungal medications and surgery, under professional guidance. It's important to consult with healthcare providers before using baking soda as a part of any treatment plan, especially for serious infections like mucormycosis. Potential benefits and considerations. While the idea of using baking soda for diabetes is fascinating, it's crucial to approach this information cautiously. The potential benefits include improved blood sugar regulation and reduced inflammation, which could alleviate some diabetes-related symptoms. However, excessive intake of baking soda can lead to side effects such as electrolyte imbalances and gastrointestinal discomfort. Therefore, it's essential for individuals with diabetes to consult healthcare professionals before incorporating baking soda into their regimen, especially those with underlying health conditions or those taking medications that could interact with sodium bicarbonate. Conclusion. The concept of using baking soda as a supportive measure for diabetes management is an exciting area of exploration. As research continues to unfold, we may learn more about its potential applications and limitations. Remember, maintaining a balanced diet, regular exercise, and following medical advice are the cornerstones of managing diabetes effectively. If you enjoyed this video, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more health tips and insights. We love hearing from you, so share your thoughts in the comments below, and let's keep the conversation going. Thanks for watching, and we'll see you in the next video.